Teen depression right now is obviously a huge issue with COVID, all of the challenges that teenagers are currently facing. And even before COVID, there really has been a mental health crisis going on in the country. So I wanted to spend a few minutes maybe just talking a little bit about medical interventions in the management of depression in the adolescent population. And that's going to be the focus. But I would start, by really reinforcing the importance of a thorough medical workup, which should include physical examination, blood work, taking a thorough history, thoroughly addressing what we would call psychosocial stressors, what's going on in the home, what is going on in the teen's peer group. Are there issues with bullying? Are there issues at school? And I also want to really underlie the importance of psychotherapy in the management of teen depression. So nothing I'm about to say is at all meant to undermine that or replace any of those things. Not to mention, I forgot, like diet and exercise, right? All of that's very important. So once all of that is addressed and you have a teen that's still depressed, the cornerstone of treatment remains antidepressants. And there are challenges with that. We still only have 2 FDA approved antidepressants. Obviously, if you look at most pediatricians, primary care physicians, certainly child psychiatrists, mental health nurse practitioners, they're not dependent on just those 2 antidepressants. So there's a wealth of prescribing of what we would consider off-label. That's not a criticism, it just shows how limited we are in terms of if you just go by FDA approvals. When antidepressants alone don't work, many times you'll see the psychiatrist augmenting with second agents. And many times it's very effective. Antidepressants have helped millions of children over the years, but they don't come without risks or costs, and I think that that's important to take an honest look at that. Most notably, things like metabolic issues. Teens are especially susceptible to weight gain at a time when they're growing, at a time when they're developing a sense of self, when they may be particularly uncomfortable with body image, and they may also already be struggling with maintaining a healthy diet. So that's asking an awful lot sometimes of children, and not to mention efficacy or lack thereof. In spite of the commercials out there, there are many people that just don't respond as well as we would like to these medications, these important medications. And it's important that there be other viable treatment options out there. We have a TMS clinic here in Marcellus. I do see TMS as an important treatment option in the management of adolescent depression. It's not FDA approved, but there are multiple small studies showing TMS to be both effective and safe in the teen population. And for parents and families, educators who are working with teens, who have perhaps tried what would be considered standard treatment options, and to have a teen still struggling with depression, I would really consider TMS as a viable treatment alternative. There's information on our website. There's a wealth of information on the web. I would really counsel people to do their due diligence, educate themselves, watch maybe even some of our videos on how TMS works. Discuss maybe with your therapist or mental health provider about whether TMS may be a viable option for your teen.